I would say my motto for medicine is to treat the patient the way I would want, knowing my skill set. And I find that most patients want the least aggressive thing done first. And usually that means like physical therapy or medication, because in my world, I'm sticking needles into people's bodies. And the thought of that to most patients is not the best. And so when you really relay to patients that you're trying the simplest things first, and if that doesn't work, then we're going to step it up to the next level of care, that makes people feel a lot more comfortable, because a lot of patients, when they go to see a physician, they're thrown a lot of like really serious, very aggressive type of treatment patterns after them. And the truth be told, most patients don't need that. They need the simple things first and then escalate the care as needed over time. And so I've incorporated that into my practice. I would say there were multiple occasions that I felt that personal gratitude of why I did this. In fact, today I actually got a birthday card from a patient today. And in the card, she actually really thanked me and my staff for getting her better to the point where she could actually get back to exercising. She could get back to all the things that she wanted to do. And it's actually really, what's the word I'm looking for? It's not redeeming, but it's rewarding. That's the word I'm looking for. Rewarding on just a personal level, that you can actually do something that people appreciate. Nothing monetary and no gift or anything, but just personal gratitude about making someone feel better. And that's probably the most rewarding thing. And that happens, I would say, a handful of times a year, where people really go out of their way to thank me for it. In fact, yesterday I had a lady that I did epidural steroid injection. She was miserable, had this very large disc herniation. She was having sciatic pain, which is that terrible pain down the leg. And she had it for several months. Did the procedure, she got up and she felt better right away, immediately. And she said, I haven't felt this good in like 6 months. And she then asked me, how long is this going to last for? And I told her, I hope forever for you. So it's nice to see those types of things. You know, I think from patients' perspective, I'm very approachable. I try to explain things in very layman's terms so that everyone can kind of understand. One of the things that I really emphasize on is showing people their diagnostic imaging, like an MRI or a CAT scan or X-ray, and explain and point on the picture why they're having issues. As the old saying goes, a picture is worth 1,000 words. You look at any of these reports of any of these imaging studies or any test that you have in medicine, and it's basically someone's interpretation. It's like looking at a piece of art and say, write a paragraph about it. And that's a very subjective type of interpretation. And for a lot of patients, number one, they're very scared when they come to see me because they're in pain. They feel miserable. Everyone is always worried, is it something terrible? Is it something very serious? Is it a cancer? Is it a fracture? Is it something that they're just going to have to rush off and have major surgery and be debilitated for the rest of their life? And when you can kind of calm things down, have a calm tone during that conversation, show them exactly on the computer screen all the imaging that's done, that makes people feel a lot better, because then they have an understanding, because it's really the fear of the unknown that what's going on with them. Most people in this world do not understand how the human body works. They have no idea. They don't have the level of education that I've been fortunate enough to have. And when you can explain it to them and show it to them in a very simple in simple terms about what's going on, that in itself is therapeutic, because now they know what's going on with their body. They know how to kind of put it in their brain, how to engage with it on an everyday basis and say, oh my God, there's something wrong with my body. Oh, it's something terrible. The end is coming. Well, it's not. You have just, normal arthritic condition of your spine. It's not really that big of a deal. But you can see that the weight is off their shoulders. They take that breath and they're like, it's okay, I can handle this.